Hi guys, today we continue our topic of general surgery, and today we mm, connect two topics and sepsis and antisepsis. I connected in one because I think I haven't got information for two another lections, and I have information for one but good lection. Okay, we will start it, and what you should know. What is asepsis and antisepsis? The difference between sterilization and disinfection, the main types of disinfectants, the main methods of sterilization, and the main types of antiseptics. Definition of asepsis: A. Without sepsis infection. Asepsis is a set of prophylactic methods used to prevent infection during surgery or any other invasive medical procedure. Antisepsis, against sepsis infections. Antisepsis represents all methods used to fight infection by destroying and inhibiting the development of infectious agents. Asepsis is defined as the absence of pathogens. Now there are two basic types of asepsis: medical asepsis and surgical asepsis. If we talk about medical asepsis, it called a clean technique, practices that kill some microorganisms to prevent them from spreading. Surgical asepsis, aka sterile technique, is there you see clean technique, there's sterile technique. Practice that completely kill and eliminate microorganisms. They're completely kill, they're kill some microorganisms. Medical asepsis includes sanitization, antisepsis, and disinfection. Sanitization refers to cleaning practices and techniques that physically remove microorganisms. Sanitization includes hand washing and cleaning of cleans, personal equipment, clothing, and linens. There are several things that you should know in order to maintain a sanitary environment. The most important one is hand hygiene, which includes hand washing and use of alcohol-based hand sanitizer. And there you see 7 steps of washing your arms. And in practice, we will ask this one from you to do. In practice, we will ask about um, hygiene method and surgical method of hand washing. Always, and we have some rules. Always wash your hands before meals, after using the bathroom, and before and after any contact with your clients. Wash your hands after touching your own or your client's body. Fluids such as urine, feces, blood, saliva, vomitus, or genital discharge. When coughing or sneezing, always cover your nose and mouth with a tissue or your elbow. Teach your patients or clients to do the same. Each client should have their own soap, cups, toothbrushes, and towels. Personal equipment should be regularly cleaned to prevent the growth of microorganisms. When cleaning the room and objects, make sure to not stir up the dust. Avoid shaking dirty linens and use a moistened cloth or mop to wipe dust. When disposing of dirty linens to laundry bins, keep them away from your uniform. This will prevent the contamination of your uniform and subsequently the spread of microorganisms. Regularly empty the garbage because trash is a perfect environment for pathogen growth. Finally, maintain good personal hygiene and assist your clients to achieve the same. Disinfection. Disinfection is the removal of many but not all microorganisms. It is a process involving the reduction of contamination up to a level that cannot cause infection, but bacterial spores can survive. It is performed with disinfectants and is only used on non-living objects. Antiseptics are mild forms of disinfectants, which can be used externally on living tissue to kill microorganisms on the skin surface or mucosa. Next up are personal items. Disinfectants. Propylene glycol and triethylene glycol can be used as aerosols or vapors, which in sufficient concentration disinfect air in hospital wards. Aldehydes are used as disinfectants. They have a strong bactericidal effect, also destroying fungi and certain spores. Chlorine and ozone are strong oxidants used for surface disinfection. Quaternary ammonium compounds, benzalkonium chloride, biguanyl depolymers, polyminopropylyl biguanide, are potent bactericides even in low concentrations. Sterilization represents the removal of all microorganisms, including multi-resistant bacterial spores. Sterile is an absolute term, which means the absence of all microorganisms. What can be sterilized? Gloves, white cloth, soft materials, surgical instruments, syringe, other medical instruments. When we talk about syringe, of course, we talk about old syringe, what is many time use. Yeah, now we use syringe, what is one time use. Sterilization methods. Sterilization is carried out by physical methods, hot, radiation, filtration, chemical methods, liquid or gaseous chemical agents. Sterilization by physical methods. Heat is the most effective and rapid sterilization method. High temperatures have a coagulation effect on proteins, destroying bacteria, viruses, or fungi. Sterilization can be performed by dry or wet heat. Heat sterilization, wet heat denaturates proteins and the DNA helix and disintegrates the cell membrane. Autoclaving uses steam under pressure at a temperature higher than 121 degree and a pressure of 1 atmosphere for 30 minutes. With the increase of pressure, the duration of sterilization becomes shorter. It's used for textile materials. It can be used for metal instruments, but the instruments used by this method deteriorate more rapidly. It can be used for plastic, rubber. It cannot be used for plastic, rubber, endoscopic instruments. It is carried out with a special device termed autoclave. This ensures vapor heating at the necessary temperature, inside pressure and circulation of overheating vapors. The materials to be sterilized are placed in special boxes that allow their passage of overheated steam. The most common type of such a box is the cylindrical containers perforated walls. A sliding metal band allows blockage of orifices after completion of sterilization. Control of sterilization by autoclaving. Automated monitoring system of the device. Bacillus thermophilus spore strips. Resist to up to 121 degrees Celsius for about 12 minutes. The strips are introduced with the other materials to be autoclaved. After autoclaving, the strips are cultured on culture medium. If sterilization has been effective, nothing grows on the media. Substances in the form of powders with a known melting point of substances that change their color at a certain temperature. These are introduced in tubes or small glass vials that are placed in containers with the materials to be sterilized. Radiation sterilization. Industrial sterilization of disposable materials, sterile gloves, sterile white cloths, drains, syringe, needles, collection bags, is carried out by irradiation with gamma rays or X-rays. Ultraviolet rays are used for sterilization of operations rooms. Filtration. Fluids, water, glucose, physiological serum, or other perfusible solutions are sterilized by mechanical filtration. Filtration is carried out through porous materials, pores less than 20-50 nanometers in diameter, which allow small molecules, but not microorganisms, to pass. Modern operating rooms are equipped with air conditioning systems which, in addition to optimal temperature and humidity, provide air filtration. Chemical sterilization. First of all, plasma sterilization is a sterilization method at low temperature used for metal and non-metal instruments. It is based on the action of ionized gases which penetrate through the paper and nylon packaging bags and induce alteration of proteins, lipids, and nucleic acids by oxido-reduction processes. Instruments are packaged in special bags and are exposed to the action of the ionized gas. The materials are sterile for 2 months as long as package is intact. Ethylene oxide sterilization. Ethylene oxide is a colorless, inodorous, inflammable gas with a high capacity to penetrate rubber, plastic, or paper. Therefore, instruments and devices can be sterilized sealed in plastic foil, similar to bags used for plasma sterilization. It is an effective method used for plastic, rubber, or metal instruments, both on industrial scale and in hospitals or medical practices. Ethylene oxide has a very potent bactericidal action, destroying all microorganisms. However, it is irritant and sterile instruments are used only after 24 to 48 hours in order to allow the residual substance to dissipate from the package of the sterile materials. Instruments can be used for up to 2 months after sterilization, provided the package has not been deteriorated. Sterilization with liquid chemical agents. Delicate instruments which have optical and/or electronic components or plastic and rubber parts combined with metal parts are sterilized by immersion in antiseptic solutions. The following solutions are used: glutaraldehyde, formaldehyde, and phthalaldehyde. There are various preparations of such substances, each having its own technical parameters that should be respected. After sterilization with these substances, the instruments are rinsed with sterile water. Antiseptics. Ethyl alcohol and other concentrated alcohols are used on the skin surface. They are highly effective in inactivating HIV, hepatitis B, and hepatitis C viruses. Ethanol or isopropanol is used. Phenols, boric acid, chlorhexidine, hydrogen peroxide, povidone iode or betadine, and chloramines. Antisepsis is the process of killing microorganisms or limiting their growth on the skin and non-living objects. Chemicals used in antisepsis are called antiseptics, and the most common ones include rubbing alcohol and iodine. Antiseptics can be used for hand scrubbing, treating cuts, wounds, and burns, and preoperative skin cleaning. And this slide just for repeating what is antisepsis in the end of our lecture. Disinfection refers to the process of killing microorganisms on objects that are commonly in contact with your clients, such as overbed tables, wheelchairs, stretchers, urinals, bedpans, and blood pressure cuffs. It's important to note that disinfection cannot destroy spores, which are highly resistant forms of microorganisms that develop in conditions that are inconvenient for their growth. Chemicals used in disinfection are called disinfectants. In contrast to antiseptics, disinfectants are much stronger, therefore they are not used on the skin. Moreover, in order to prevent skin irritation, you should always wear household or utility gloves while handling disinfectants. Surgical asepsis. Example of surgical asepsis includes the use of disposable sterile supplies such as syringe, needles, and surgical gloves, and the use of reusable sterile equipment such as surgical instruments. Most commonly, surgical asepsis is acquired through a process known as sterilization. You can think of sterilization as the highest level of asepsis because it kills both microorganisms and spores. Just like disinfection, sterilization is not used on people. Instead, it is used on equipment and instruments that must be totally free of microorganisms. For example, a commonly used device to sterilize surgical instruments is the autoclave, which uses high pressure and temperature to kill microorganisms and their spores. Finally, it is important to note that Before something can be disinfected or sterilized, organic materials such as blood, feces, or urine must be removed using sanitation practice and techniques. Thank you very much for your attention, guys, and have a nice day. Bye bye.